A very good evening to all the viewers. I am Dr. Shweta Ghadge from USV and would like to welcome you all to today's IJCP Cough Remedy Talks on challenges and management of productive cough in children. Switch to dry ivy leaf extract. Cough is the most common pediatric problem managed by doctors. There are multiple causes of cough, and extended duration of coughing causes distress to both children and their parents. Management of cough becomes difficult since effectiveness of traditional medications to either cure or relieve symptoms of cough in children is a challenge. So, to discuss more on the challenges in the current management of productive cough and the use of dried ivy leaf extract cough syrup, I welcome Dr. S.M. Prasad, sir, Professor of Pediatrics, Dr. BRAMC, Bangalore. Thank you, sir, for joining us today for this chat show. So, sir, we would like to understand that what are the worrisome consequences of productive cough in children and what is the impact seen on the parents? And also, is there a role of dry ivy leaf extract in the productive cough?
Yeah, good evening, Dr. Shweta. So definitely we are coming across so many children with productive cough. So usually it is a very worrisome for the especially parents. So I would like to mention here that about seasonal, like now we are getting high humid weathers. So definitely there is a chances of not only the infection, even the allergic factors play a very important role in lower respiratory infections as well as in bronchitis. So many parents are worried why every time not only we have suffered from COVID for the last 2 years and we get so much tensed up whenever there is a onset of any bronchitic type of picture in a child or even in small infants. So it is definitely irrespective of whether the child is an infant or a bigger child or a school going child or a preschooler. Definitely these repeated infections which are happening due to changes of, it can be due to changes of weather or the onset of viral infections in the community. Definitely it is a worrisome. And also nowadays even the schools have restarted most of the schools gradually, and definitely even the parents of school going children are so much worried about the cough. So, and also they are fed up with so many chemicals which we are using, like it is like any of the, sorry. So any of the cough or medicines which is affecting their, this one definitely is going to be a worrisome for them. So another thing is, so they are asking for any medicine which can support the treatment of cough. So that is the worrisome for the parents as well.
Yes, so sir, here I do understand that that there are infections on the rise, especially with seasonal changes, and also that children are getting repeatedly infected, which leads to a lot of distress in the children and also to the parents. And sir, here you mentioned about medications with synthetic chemicals in it, which generally are very create a lot of side effects in the children, especially. So, what are the challenges of the current medications used for respiratory infections in children? And also, is there a role of dry ivy leaf extract in curbing all the side effects caused by the medications available?
No, I don't say severe side effects, because whenever we give it in a proper dose, especially for children, especially the antihistamines are the for wheezing disorders. So it should not cause issue, but very selecting. We are giving repeatedly, so the parents are so much worried about it. There may be some side effects and all. Repeated use of the antibiotics. So there we need to curtail down. Are there any other products which can support, just like our whatever food we eat, like Anita, support like a home remedy or something? Then we think of any of the syrups which are may not be having some of the side effects. But it is not, whenever we use an appropriate dose, there should not be any problem about the medicines. But sometimes the children may, suppose if you use an antihistamine, they go into sleep. So that can happen. That is not, I don't think that everything they will be all right when you give a medicine. And some of them may be allergic for some of the antibiotics. So we cannot use even if it is a bacterial infection where the antibiotics are indicated. So with this in mind, we have a supporting medicine, something which is been approved by DCGI. It is not like any other medicine apart from the allopathy medicine. But when it is approved by the DCGI or CDSCO, then definitely we have a role. There is, because some of the ingredients inside, that definitely they are going to play a good role, and also there will be advantages for the child with a chronic cough. So we term it as chronic cough whenever it is going for more than 4 weeks, but the Thoracic Society says it is more than 8 weeks. But still, we have to think it is a worrisome when it crosses 4 weeks of symptoms in a especially small child, and that too. Now we are expecting a fourth wave. So that time, now they have started whether it is becoming COVID, whether it is there like that. This is also happening now. But still, we have to keep our hands crossed, and also we should be alert whenever there is a child with some chronic cough and fever and happening in the society or in the family at large. First, we should think of a viral infection which is causing the infections. But still, we need to do a plan or give a protocol to the parents. So among the protocol, if we are still worried, do we have a cough syrup along with that as a supplement to whatever we are giving from the medicine list? So that helps them a lot, and also a soothing relief for the child. Definitely, that will help them a lot. So they don't think that everything we are giving so suddenly, all the medicines we are giving suddenly. And every time I go to a doctor, always I have been prescribed with so many kinds of medicines that will not be there in their mind also. But ultimately, our aim is to give comfort to the child who is having the chronic cough. That is what I want to say. But within our whatever the limitations of using our dosage schedule, if you follow, and we should have we should exercise caution when prescribing the dosing and all. We have to have an extra care while prescribing the drugs. But as it is a DCGI approved, definitely even IV extract has been used all over the world. It is not just a new drug. It has been accepted all over the world. It has been published by pharmacopoeias. So it can be considered for use. That is what I want to say about the coughs management in children. So that is the one thing.
Yes. So, sir, I agree that, there is, as rightly mentioned by you, that there are multiple medications available for treatment of cough, and the dosing, if given properly, will give the relief that is required. But even with, even like how you mentioned about Ambroxol like medications, which are a cortico or a steroid like medications which cause sleep or other side effects, and there are allergies to certain antibiotics which is generally seen, and all of this is not seen with dry IV leaf extract cough syrup at all. So in terms of sir, in terms of say the use, so can it be used for relieving acute and chronic cough in children? How exactly does a dry IV leaf extract cough syrup work to relieve acute and chronic cough in children?
So usually this particular product, IV leaf extract, so the studies have revealed when they are use this to relieve cough in our toddlers and preschoolers especially. So this definitely it is going to help in respiratory problems mainly. So this is it is going to be a mucolytic. Almost it acts like a mucolytic. And there is congestion is relieved because whenever the child coughs, it is going to easily expectorate the whatever the sputum that is there, and we may come across little rhinorrhea in the nose that can happen because it is going to loosen whatever the congestion that is happening in the upper airways also. So that one I can say. Even many of the random control trials they have done it, and it is known as Hedera helix. This IV, that is the name which is given to that, and usually in acute viral infections, it helps a lot for children, especially the toddlers. So many of the random RCTs which have taken place using this product, so there is a relief, and many patients and many of the parents, they have accepted this treatment all over the world, and even they have studied the children between 0 to 12 years as well.
Hmm.
And usually it is a TID dose. It is been given in the form of syrups. It is there actually.
Hmm.
And many of the whoever makes it, so usually for children 2 to 5 years, they give 1 spoon 3 times daily. And those who are between 5 to 12 years, school age children, 2 spoons it is given, that is 10 ml 3 times daily. Then for adults, even adults, they can give, but that is 1 tablespoon. That is, sorry, that is the 15 ml, not a teaspoon, it is a tablespoon. 1 tablespoon 3 times for adults. That has been recommended by whatever the pharmacopoeia we have come across, whatever I have come across about this IV leaf extracts.
Yes.
And,
So, yes.
and also there are some constituents in this IV leaf extract. They have found out that they are all similar to the anti-inflammatory effects and all they have. Like they have these saponins. So they include this bisdesmodic heterogenein and oleinic acid and some of the glycosides, then heterocosides. All these are available in this extract. That is one which is helping for the relief of cough or chronic cough which is happening in children. Also, it is having a spasmolytic effect, especially for this acting on the circular smooth muscle of airways, so which is causing bronchoconstriction. There also, it is going to be having a secretolytic, that means decreasing the production of mucus. It is going to help, and thereby even as an oxidant also, it is having a role. And even chronic bronchitis, that is how it helps. It is also having an effect on the smooth musculature of the airways. So that helps a lot to relieve the bronchoconstriction. That is what has been studied. And also it is containing flavonoids, so which helps not only as an antioxidant, but also it is going to having a toxiolytic effect, thereby helping for the infection. So even it helps for even for good circulations and all otherwise, but that is not for our this one. But as far as the respiratory system is concerned, definitely it is having a very good role because of its anti-inflammatory, mucolytic effect, and also the bronchodilator effect in the smooth vessels, smooth musculatures in the airways. And it
Yes.
has been that I was also worried. Does it belong? Why? My question came, why this leaf extract? How we can use it? But once I know that it has been approved by the DCGI, our DC, that is Indian Pharmacopoeia, that is once it is there, then I think we can easily take up this molecule for the use in respiratory disorders, especially toddlers and preschool.
Yes, sir, wonderfully explained the entire, the actions of dried ivy leaf extract in relieving cough. So, like you mentioned, that it has anti-inflammatory properties, it has mucolytic, secretolytic, bronchodilatory effect, and anti-inflammatory effect. So, all of these does, act on multiple cough causing indications and helps relieve gives relief to the patient. So here, sir, we would also like to understand, you mentioned about expectoration, which is very commonly a problem that is seen in young children. So can dried ivy leaf extract help in expectoration in very young children?
Yeah, definitely. Even it is going to help for the small children, but only the one problem might come, the running nose might increase. The rhinorrhea, like when we use Ambroxol or Budesonide, when we use this like Ambroxol or mucolytics. So definitely there is something, but it is going to give a relief at the end. So definitely, even irrespective of the age, this can be safely used. That is what our literature also says. And also the other thing is what I found, even the sterols are there, like phytosterols are also available here. Even that is having a role as anti-inflammatory effect in these IV leaf extracts.
Yes. And sir, you mentioned about, it being useful in bronchitis, where due to the properties mentioned, it helps in bronchitis. So, sir, are there any specific symptoms of acute bronchitis that IV leaf extract cough syrup have? Does it alleviate certain symptoms? Which symptoms does it alleviate of acute
No,
bronchitis?
definitely the wheezing issue or the bronchoconstriction, as I told you, it is going to get relief. So
Hmm.
definitely wheezing will come down. The
Hmm.
symptoms of bronchi, like it can be audible wheeze or even the rhonchi when we examine, so that is a good improvement. And also respiratory rate will definitely come down. The child is able to expectorate, or in a small baby not able to do it, but because of the thinning of the secretions or the mucus, that is
Hmm.
definitely the child will have a better
Hmm.
airway or better inhaling or the inspiration expiration. Once it is better, definitely it is having a good role. But only thing, the thing is, in a small baby, the definitely rhinorrhea will increase. The chances
Hmm.
are there. Just like how we use a mucolytic, it is going to use it. It will have an effect. But also, meanwhile, it is also having an anti-inflammatory effect. So that scores a good this one, because instead of using three or four, this one all are there in this one product, which can it helps for multitask. It is a multitasker almost, I can say, because for everything action we need one for agent. But a medicine, a pharmacological agent, here I see about two to three are there in one product. So definitely it should score well when we start using in our day-to-day practice.
Right, correctly mentioned, sir. That the secretolytic properties, the bronchodilatory properties, and the mucolytic properties, all of these are all in an amalgamated mixture is seen in with dried ivy leaf extract cough syrup, that is Prospan. So here, sir, we would also like to know, since you mentioned about it being effective in multiple respiratory tract infection, does it also have or can be used for asthma in children?
But not may not be in all cases of asthma.
Hmm.
But when it's in the already there is some secretion, mucus
Hmm.
production is there, some
Hmm.
amount of bronchoconstriction is there. So
Hmm.
in those cases, it will have an effect. But
Hmm.
advanced cases where it has gone far beyond, or an acute asthma, it may not be having a role. But in a chronic wheezing disorder or
Hmm.
bronchitis, definitely this is having a role. Some as an additive, better to give it so that it will help for a long term management, that to oral management with the least side effect.
Hmm. Yes,
So
yes, agreed.
that is
Hmm.
there.
Hmm.
But we
Yes.
cannot take this as the alone treatment for
Yeah.
bronchial asthma and all. Apart
Hmm.
from our whatever we are using, inhalation therapy, aerosol therapy is what we use. That is the latest thing what we are using in bronchial asthma. This will
Hmm.
be an add-on for the
Hmm.
supportive medicine for
Hmm.
the small baby, where he is unable to cope up with, even the tastes are better compared to other syrups. That is
Hmm.
what I come across. So
Hmm.
the taste of this is acceptable to the children. So easily they will take. That is very, very important when we prescribe any medicine to small children or the babies, so that they don't spit it out.
Hmm.
So the
Hmm.
acceptability tolerance, once it is there, definitely it will be an add-on. But that is not the treatment, but it is an add-on for any of the our management in respiratory infection. That is what I can easily say that.
Mhm. Yes, agreed, sir. So, as an add-on, it can be used in asthmatic patients and also to relieve cough in acute bronchitis or acute cough. It is having significant role, and so this is the message that we would like the viewers to know, and also about sir, you mentioned about how it is can be taken so well because of the pleasant taste. The current medications with the side effects, they also have an unpleasant taste, which is not the case with dried ivy leaf extract cough syrup. So sir, here since we discussed about the available medications, so there is acetylcysteine and ambroxol also used for upper respiratory tract infections. So is there a benefit of dry ivy leaf extract cough syrup when compared to the available medications in children with upper respiratory tract infections?
Now, usually, even Ambraxal doesn't have that kind of this one. Any side effects not much reported, but still, it is not indicated, especially in cases of, according to our protocols, it is not indicated for childhood asthmas.
Hmm.
Mucolytics is
Hmm.
not you. It is not a indicated drug at all, but it is there in so many combinations in so many syrups. But the beta 2 agonists, so that they are the only ones which we use it, but not the mucolytics are having a least role in the management of childhood asthma.
Hmm.
So that we need to remember, and
Hmm.
in what way, in judicious way, we can use this leaf IV extract.
Hmm.
Uh, it is almost like a very supporting medicine for the children
Hmm.
with wheezing disorders. So it
Hmm.
has having anti-inflammatory mucolytics. Definitely, it's having a role,
Hmm.
but not to cause any disturbance, not to cause in the acceptance of the medicine. That there it scores well.
Hmm.
But whatever the mucolytics, it is there. But in a childhood asthma, we don't use it actually.
Hmm.
Not like in adults. Adults, it is used like any other drug, mucolytics. But in children, childhood asthma especially, mucolytics, not much role. Not much
But
role.
sir,
But
in
here,
acute, yes, but in acute or chronic bronchitis where acetylcysteine and ambroxol are used, so in that cases, can dried ivy leaf extract when compared has does it have any benefit?
no, additionally, it will have a benefit,
Hmm.
but not alone. Not alone.
Hmm.
But in a mild asthma or mild wheezing disorders, there it will be having some role.
Hmm. Hmm. Hmm.
But some of the studies which have been done, the RCTs also they have taken place before uh, it was licensed by DCGI. So
Hmm.
there, so that good the effects are better. So it has been studied as a better drug and a good drug and reasonably tolerated drug. More
Hmm.
than anything, tolerance or the tolerated drug among the children.
Hmm.
That is
Hmm.
very very important.
Hmm. Hmm.
So
And,
definitely, but
hmm.
any medicine can score over other. But the thing is how it is being tolerated by small infants and children. That is important when we are.
Hmm.
So definitely, I say this is an add-on drug, the add-on medicine. So
Hmm.
it can be definitely given, especially without any second thought. You can use it actually.
Hmm. Yes, yes, agreed, sir. That because of the multiple benefits that the dried ivy leaf extract provides, especially in the multiple respiratory tract indications, it does have a significant role to play and can be used as an add-on in certain indications. So, sir, we discussed about you said about the tolerance in children, how important it is that medications need to be tolerated. So, sir, is dry ivy leaf extract cough syrup considered a safe medicine to be used in very young children?
Yeah. Unless there is, if the safety is not established, if there is any side effect or any of the adverse reaction due to that, definitely would not have been licensed by the DCGI. That is
Hmm.
number one point. The
Hmm.
second point, whatever the study they have done among many studies, among 284 studies in with children in children, there are many studies. It is not 20 or 30 children. They have studied sufficient
Hmm.
number of children in many of the studies which I have come across.
Hmm.
So even multi-center studies they have done, and definitely it has scored better. And
Hmm.
so there is no adverse reaction or any like side effects not been reported in these studies.
Hmm. Hmm.
And it has been accepted in many parts of the world. It is not just in our country or neighboring country. It is
Hmm.
in many parts of the world. It is there in many countries.
Hmm.
So the usage only, whether it is accepted or not, that was the question.
Hmm.
But because of the multi-tasking effect of one drug, so probably it is a good drug, probably, especially for the respiratory disorders. It is only targeted for the respiratory disorders,
Hmm.
not for anything else.
Yes. Yes, sir. So, like rightly mentioned by you, that considering the safety data that is available, and also that it's been prescribed all over the world, and DCGI has given an approval to be prescribed by doctors. So it does have a safety assurance that can be used in very young children as well. So, sir, also what we would like to finally know is your clinical experience with Prospan and with dried ivy leaf extract cough syrup. Has how has it benefited in your clinical practice?
So I have used in between some of the children, but not all. But still, I need to get more experience with this product, especially. But
Hmm.
I have found, as per some of the research papers I have just seen, so
Hmm.
it has been accepted in so many centers.
Hmm.
But still, we have to use this in more often, maybe in the coming days.
Hmm.
Uh, Whenever I come across any children with wheezy bronchitis, either a
Hmm.
toddler or the school
Hmm.
children, school age children.
Hmm.
So I think after some days or some weeks, I will be able to get to
Hmm.
know more about this particular product. I've used, not at all use it is not like that. I have used this product, but
Hmm.
maybe I have to start using in more number of children in our nearby areas. Then I will come to know more about it. Then I will
Hmm.
be able to share more about this drug.
Yes. So, sir, with the kind of data supporting the dried ivy leaf extract and its multiple actions on how it relieves cough and various symptoms of acute and chronic bronchitis, and the safety profile, especially in children, and also the fact that dosage is not really a concern, and with the taste being a pleasant one, all of these factors do provide the dried ivy leaf extract cough syrup and added advantage, and can be used in safely in school children. So, sir, we would like to know your final message to the viewers.
So definitely, as before, I thought I have told you that whether how to use this, does it come under our pharmacopoeia or not? That was my first question when I started thinking about this when the products was introduced to me. But over the time period after the usage and all, I know that the acceptability was a good thing for especially small children, and
Hmm.
also no adverse
Hmm.
effects or they were not reported wherever I have used, and
Hmm.
also it has been used especially the bronchitis. It will have a major role. Or there is a lower respiratory infection in small children, wheezy bronchitis. There it may have a definitely add-on benefit,
Hmm.
and also small children especially till the age of 6 months, so the
Hmm.
smooth muscles of the bronchioles are not that much well developed, so
Hmm.
definitely there also it might give a good effect, but I have not tried for below 6 months. I'm just for preschoolers I have tried, but
Hmm.
not below. But according to the papers and whatever the trials that have undergone, the literature on this, it says that even it can be used for even small infants. It is having a role.
Yes. Hmm.
So whenever we manage a child with a wheezing or respiratory infection, the single drug may not be effective one in all the times. So that
Hmm.
time we take it as how much every drug can contribute for the uh, recovery or the maintenance of a respiratory allergy or the infections which goes on in small children, either
Hmm.
in preschoolers or the schoolers or even the toddlers also we need to know about more. So I think further also once we start using, definitely it will give a better result. Then we will come to know how much we can take it up for.
Hmm. Yes, thank you, sir, for sharing your insights and for explaining the role of dried ivy leaf extract cough syrup. And it is very important for the audience to know that such a medication is available and that it can be prescribed safely in children. So this is something that we aimed to look for, and thank you for helping us with that, and also for sharing your experience with dried ivy leaf extract cough syrup. So I and taking the time out for discussing the same. So thank you, sir.
Thank you. Thank you.